And welcome to the Shatkin First Monday Morning Minute.
Good morning and welcome to this Monday Morning Minute. Today we're going to be doing a simple upper denture stabilization on my patient, Deborah, who's been wearing dentures. How long have you been wearing dentures, Deborah?
2 or 3 years.
2 or 3 years? You had all your teeth taken out a couple years ago?
Yes.
On the top?
Yes.
And you have a partial on the bottom?
Right.
So the upper denture she has a tough time wearing because it moves around and it gags you?
Yes.
All right, so we're going to go ahead and mark your gums. We've already anesthetized her. So we're going to mark the gums where we're going to place the 6 mini implants. Okay, and we're going to go ahead and make our first pilot hole. So we're going to start right here. You want to make sure you feel the bone as much as you can so that you stay between the buccal and lingual plates. And it's always a good sign when you have bone on the pilot drill. That means you've made your hole in the right spot. So here's our 2.0 by 13 millimeter implant. And we can get a visual of the x-ray at some point, but we're angling this a little bit toward the palate to make sure we don't come out buccally, and I'm putting my finger here. And that's a good sound. We're always happy to hear that sound. We have 30 Newton centimeters of torque. Now we're going to go up to 60. And there's that implant. We leave the square and the ball above tissue. Okay, so our first implant's in place. Now we're going to go ahead and make our second pilot hole. And sometimes I do this. I'll leave the pilot drill in place. That way I'll be able to find the hole and the angulation. Stay open. It's like a guide pin. A little trick I use quite a bit. So here we're going to take this and I'm going to have my assistant Joanna remove it slowly. Hang on so I can see it. All right, go ahead. Try to remove it slowly. Can you twist it? Is it coming? There it goes. All right, so we're just going to twist it and remove it, but not all the way. I'll tell you when I want you to take it. Okay, go ahead. All right, so now I got the tip of the implant right in the spot where that pilot hole was. Makes it a little easier to find the hole, especially when you have a lot of tissue. And again, we've reached 30 Newton centimeters of torque.
Yeah, seriously.
Now we're going to go to 60. Very good. Now we got 60 Newton centimeters of torque. So now we have 2 implants in place. It's beeping at 60. That's excellent. That's the Shatkin First Aseptico motor. Okay, we're making our next pilot hole. Again, you can see the bone on the pilot drill. Now we're going to go to setting number 2. Setting number 2 is your 35 RPMs, 30 Newton centimeter torque. Again, we're going to feel the buccal plate, make sure that we're not perforating during placement, keeping the implant away from that concavity on the buccal. Open. Open big. All right, again, we got 30 Newton centimeters. Now we're going up to 60. And then we got 60 Newton centimeters of torque. So you're setting number 3 again. 60 Newton centimeters. Okay. And again, we're going to keep the square and ball above tissue. Why is that? The reason for that is you want to have room for this O-ring housing to compress a little bit. You want to have a little bit of space so that it's not hitting against the tissue. Okay? All right, 3 implants are in. I'm just going to try her denture back in. We did trough out the denture, but it might need some more troughing. Yeah, it's definitely going to need some more troughing, but we can work on that. All right, let's go ahead and do the next, the other side. Okay, that's our first hole. And we got good beeping sound again. Okay. All right. Now we'll do the next one. Okay. You're doing super, Deborah. We're on our 5th out of 6 implants. You're in the home stretch. You got good beeping there. She got very good bone. She doesn't have a lot of it, but the bone she has is excellent. We'll show you the cross section of the CT scan after to show you where the bone was. Okay. All right, and we'll do one more implant. Okay. I work with 2 assistants. I have Sunny here handing me the implants and Joanna assisting in the mouth. And this is a 2013. Open big. We're using all 2.0 by 13 millimeter implants. Open real big. Like I mentioned earlier, we typically would use 2.5s, but her ridge is very narrow, as you'll see on the x-ray when we get done here. Okay, we got good torque there. So we pass the torque test. Okay, we have all 6 implants in place. Now we're just going to try this in. I think I'm going to have to go in the lab and trough it out a little bit more. Well, that's pretty good, actually. Let's go ahead and put the housings on. I do feel a little bit over here. Let me adjust this. Bite together. Bite. Okay, open. 2 more.
want her partial one for the pickup?
I don't think she can really wear it very well.
Okay.
It's painful for her. I can try it in,
Just for
but
the bite.
yeah, it would be good if we can get it in, but I don't want it to hurt her.
Mm-hmm.
I did adjust it. Maybe that's a little better. Open for me. Bite together. In the back. Bite in the back
Other way.
teeth. Right there. Okay, that's pretty good. Open. All right. I'm going to pick the housings up now.
You want to show them that?
We troughed out her existing denture, and we're using the Shatkin First pink implant attachment reline material. Okay, so we fill the trough up. We're going to go ahead and put it in her mouth. Okay, go ahead and bite together, nice and tight. Okay, hold that together nice and tight, okay? For 5 minutes, all right, Deborah? Okay, we got it.
You okay?
All right, and here are the 6 housings. She had some undercuts in the gums. Yeah, there's a little bit of cement here. It's locked into her undercuts, but we got it. I'm gonna go in the lab and adjust this now. We're gonna try this in. Let me see if that's up all the way. I'm not sure. There it goes. Yeah, there we go. Bite together. Is that in all the way? Let's see. Open. Let me see. There we go. Now it's in all the way. Okay, bite together. All right, bite. How's the bite? How's the bottom feel? Is it painful now, or is it getting a little better?
Getting better.
All right, I adjusted it. Why don't you try to keep that in too and see if you can get used to it, okay?
Okay.
This is a little thick, this denture, but that's just the way it was made, you know? But we can take a little more off when you come back next week, okay? But it's snapped in and it should stay very nicely.
Thank you.
Okay, I want to show the video now of this CT scan showing just how narrow that ridge is and seeing how we bisected the buccal and lingual plates with these 2.0 by 13 millimeter implants. You can't get much better than that, right in between the buccal and lingual plate. And here, again, we got about a 0.5 millimeter on each side of the implant. And there we had a little more bone toward the posterior. So we had a great result. Let me go back and show you the pre-op so you can see the cross section of this. Just how little bone she had to start with and what we were working with. So again, here's her cross section pre-operatively. You see how thin that gets right up in there. So we're very fortunate that we were able to get the mini implants in here. It gets a little wider toward the posterior, but in the anterior it's very, very thin. So again, there's her pre-op, there's her post-op, and Deborah had a wonderful result. We will cut out the plastic on the roof of the mouth at a later visit. But here you can see just how thin that ridge is and how we were able to bisect the ridge with the 2.0 millimeter mini implants. There's no other implant in the world that you could use on a patient like this. The mini implants are the only option. She had a great result, and we'll see you on Monday, okay, Deborah? Thank you very much.
Thank you.
Have a great weekend. Okay, so thank you for joining me on the Monday Morning Minute, and I'll see you next Monday.
Join us this November for our last advanced mini and mono implant course of the year. Dr. Gordon Christensen will be joining us. So Dr. Shatkin, Dr. Christensen, and some guest speakers from our International Academy of Mini Dental Implants will be speaking. And then on Saturday, we got a special guest, Dr. James Tharp. He's going to be talking about his 40 years of implantology. Then he's going to get into a little bit of problem solving with minis and monos. So that'll be very interesting. And then he's going to finish the day off with teaching people a little bit about how to take the best pictures, some dental photography. So if you have not signed up for the course yet, please sign up. You can do it online at shatkinfirst.com, or you can call in and talk to any of our sales reps, and we'll be happy to get you signed up. So sign up today, and we look forward to seeing everyone out in Buffalo this November.